Hi, I'm Alyssa Tate from Equilibria Education, and today's question is, how long should it take for curcumin to take effect as an anti-inflammatory in our musculoskeletal patients? A secondary question here might be, should we go by the patient's symptoms or by blood tests? The answer to these questions depends largely on what we're trying to achieve with the patient, but first of all, an overview of curcumin. Curcumin is a phytochemical extracted from the turmeric rhizome. Most people know of turmeric as the ingredient that gives curry its bright yellow-orange color. It's a major part of Indian cuisine. However, to use turmeric medicinally is challenging. It's difficult to consume enough turmeric to get a therapeutic effect because the bioavailability of its active ingredient curcumin is very poor. While consuming turmeric together with black pepper and some form of oil or fat can increase the bioavailability of curcumin, it's still not a reliable medicinal anti-inflammatory. That's where curcumin comes in. Curcumin does have effective anti-inflammatory effects as an inhibitor of NF-kappa beta. However, it's mainly effective at higher doses or with curcumin formulations that have been prepared in such a way to improve their oral bioavailability. So with your patient with musculoskeletal pain, for example, associated with osteoarthritis, how long should it take for them to get pain relief using curcumin? Are we talking weeks or days? Actually, we should expect some changes within hours, especially once you've been taking curcumin for a period of time. While the initial effects may take a few days or up to a week, once you're on it regularly, if you miss a dose, it may become apparent within hours or, even sort of a day or two. So overall, we're expecting quite rapid results on the pain, certainly within the first bottle. So if your patient has switched from NSAIDs to curcumin and they have a dramatic increase in pain in that first week, you can conclude that curcumin is not working as an effective pain reliever for them, at least in the form or dose that it's being administered. But we all know that pain is multifactorial and a more complicated clinical scenario generally than inflammation. So if your patient is using curcumin to address systemic inflammation, we get a different answer to the question of how long it should take to take effect. Is considered to be between 0 and 5. So this does seem to be quite substantial. These results were achieved in a minimum of 10 weeks, although when the more sensitive HS-CRP assay was used, which is high sensitivity CRP, the results were achieved in less than this time. So if we want to see an impact on the systemic inflammation in our patients, we're really looking at, I guess, between a 6 and 12-week trial, depending on the sensitivity of the blood test that we're using. Thanks for watching Equilibria Education. I'll talk to you again soon.